So the last study I'm going to talk about comes from the open dialogue approach, which is used in parts of Finland when responding to early episodes of psychosis. To give you a little bit of a background on this, in the 70s and 80s, there was a group of clinicians in Finland that started treating psychotic patients with what they called a need-adapted treatment approach. So this was a very case-specific and conservative approach to using medications. They wanted to keep people off drugs. If possible, they wanted to keep them out of the hospital. Really, the core of the treatment was more of a social approach. The driving intention was to help the patient reintegrate back into society. And what these clinicians thought was that a lot of the patients had trouble or weren't ready to be adults yet. So they wanted to help them with their development so that they could fit into society. They developed psychosis teams of 2 to 3 people, which could have been psychiatrists, psychologists, nurses, social workers, and they would meet with the patient and the patient's family and do group family therapy. And this was a big part of treatment. And they wanted the patient to collaborate and make decisions when it came to their treatment. They wanted to strengthen the patient's grip on life. A lot of the conversations that they had in these sessions may have been focused on past successes and achievements of the patient to try to reestablish their connection with society. They wanted to help the patient construct a new self-narrative where they could imagine themselves in the future being integrated back into society instead of being isolated. They really wanted to keep the patient from being isolated, which is sort of the opposite of what we do in the West. Our treatment approach is much more alienating. So this approach to treatment makes sense if we think about Jung's concepts of progression and regression and on how psychosis comes to manifest. So if we remember what progression is, it's when our psychic energy is focused on meeting the demands of the external world, on adapting to our social environment. And whenever this is blocked or becomes stagnant, or we're unable to take a developmental step, such as becoming an adult, then progression stops and regression kicks in, and then our psychic energy is focused internally towards the unconscious, which stimulates unconscious material and content, which then comes out in the form of psychotic symptoms. So essentially, in this treatment approach, they want to help kickstart progression again so that the patient's psychic energy is focused more on being able to meet the demands of the external world, which in turn helps them deal with the psychotic symptoms or helps these symptoms abate and dissipate. So out of this approach in the 90s came an offshoot called open dialogue therapy, which essentially has the same core basic principles to the treatment. There is a psychosis team of 2 or 3 people, and whenever someone is going through an episode, they will call, and this team is supposed to show up within, I think, like 24 hours and meet with the patient and with the family and have an open dialogue discussion about what's occurring. They try not to use any medications, especially in the first few meetings. They may prescribe some medications if the patient isn't sleeping and if they're not like taking care of their activities of daily living, like bathing regularly, then they may give them like a low dose of something. But essentially, they want to help the patient strengthen their grip on life, to reestablish social connections, and to keep them out of the hospital. So if we look at what's on the screen here, this is results from a 5-year study where they used open dialogue therapy. And this particular area in Finland is called Western Lapland, and this is where it's used most heavily. So we can see here, let me pull up the laser pointer. So 67% of these patients, out of 75 patients that were experiencing psychosis, 67% of them were never exposed to an antipsychotic. 33% had occasional use during 5 years. They were given antipsychotics at some point, and only 20% of them had ongoing use of antipsychotics after 5 years. So we can see 67% of patients treated with this approach did not relapse during 5 years, the same amount that was not given an antipsychotic. 79% of them were asymptomatic at the 5-year follow-up, so they didn't have any symptoms of psychosis. And the major thing is that 73% of these patients were working or in school at the end of 5 years, only 7% unemployed, and only 20% were on disability. So these are much better numbers than we would see here in the West. And I should also say that at the time Robert Whitaker published his book Anatomy of an Epidemic, in Western Lapland, there was a 90% drop since the early 1980s in new cases of schizophrenia. So his book was published around 2010. In this period of 20, 30 years, there was a 90% drop in new cases of schizophrenia. So the important thing here that we learn is that how we respond to the early episodes of psychosis or schizophrenia, very important to the progression of the illness and if people recover and get better. Now, we do see from these results that 20%, around 20% have a chronic course. So perhaps this is pretty accurate when it comes to overall diagnoses of schizophrenia. Maybe 20% is chronic, but there is a large proportion that will either recover or that will recover enough to be able to function semi-well in society. And this is not the case today, at least in Western society, under the care of conventional psychiatry. We see much more impairment in these individuals and much less recovery. So I would use these results to argue that at least a significant portion of people who experience psychosis, who are diagnosed with schizophrenia, don't have a brain disease, and the psychosis and these symptoms are closer to what Jung described in his model than the medical model explains it by.